Hello everyone, let's try to solve this question together. So preterm infant is started on acetaminophen for findings noted on the echocardiogram. The true statement about this case is, pause the slide, take a look. Okay, let's sort it one by one. So what is the finding here in the echocardiogram? And you guys can appreciate that there is a PDA here. So PDA, the treatment is using non-steroidal anti-inflammatory drugs. So among those, there are three drugs which are used. One is indomethacin, one is ibuprofen, and the other one is acetaminophen. So basically, the question is regarding that. So what is the correct choice here? Let's go with the correct choice and then we'll walk through. So the correct answer is that acetaminophen is not a cyclooxygenase inhibitor, and we'll know in the next slide. Let's try to answer the first item, which shows that acetaminophen has a better safety profile. That is wrong, as reviewed recently in a paper. You guys can pull that paper. And basically, these are the references cited in that paper that acetaminophen is recently found to have some complications. So it's not like a safe drug and use right and left. The second two questions were about the acetaminophen should be used in caution with platelets and a COX inhibitor. As you guys can see that acetaminophen is a peroxidase inhibitor, so it doesn't act on this side. So that has to be noted. The other thing about platelet count, that as acetaminophen is not a COX inhibitor, is that it has no effect on platelet or thromboxane pathway and causing less platelet aggregation as compared to the other non-steroidal anti-inflammatory hormones. And this is a slide again, talking about the cyclooxygenase inhibitors. So two are, like we said, common: indomethacin and ibuprofen. And they are different in their action because ibuprofen is non-selective and indomethacin is selective. So in conclusion, three drugs are used for PDA: acetaminophen, indomethacin, and ibuprofen, and all are potentially okay, whichever your unit want to use, one over other. The only thing you have to know the difference between the action, the two, which is ibuprofen and indomethacin, acts on the cyclooxygenase pathway, while the acetaminophen acts on the peroxidase pathway. But the end result is the same, that ultimately they cause ductus to close because of the prostaglandin inhibition. I hope this makes sense, and you guys have a wonderful day. Bye.